Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahicha Hotel, Murang'a Town, kũng'ethera na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Robogo Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakĩma Modern House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725 8641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku.
Kuza ICT Awards 2024 is here, and GTN TV has been nominated in the People's Choice Awards category as the TV Station of the Year. To vote, text Kuza to 15601 or visit www.kuzaawards.co.ke and vote for Grassroots Television Network. Voting is free. GTN TV, the home of gifts and talents. The Nyeri County Annual Tourism and Cultural Festival 2024, initially slated for 17th to 18th May 2024, has been postponed to 21st and 22nd June 2024 due to the heightened persistent rains accompanied by floods being witnessed in the region. We sincerely apologize for any inconvenience caused and assure you that all necessary arrangements are being made to facilitate a seamless transition to the new dates. For more information, contact the Director, Tourism and Culture, Mary Kimamo, on 0722233420 or email us on nyericountytrade@gmail.com. Thank you for your continued partnership.
A warm evening, and this is the Medi-Camp Health Show. My name is Mumbi Mavuti. Today we are going to be talking about tuberculosis, and Dr. Beatrice is joining us for the same, all the way from Othaya Level 4. Thank you so much for making time for us. It's quite an honor to have you back. Yes, kindly say hi to our viewers through that camera, and then we'll start.
Okay, evening too. I hope you are doing well back at home. Stay tuned and you will learn something about TB.
Yes, thank you so much. I said doctor and you looked at me. Did I miss on the title?
No.
Sawa. So we are going to be talking about TB. What is it?
Okay, TB, it's an infectious disease, usually caused by Mycobacterium tuberculosis. It mostly affects the lungs, but it can affect other part of the body, a part of the hair, nail, and tooth. Yeah.
You mean it affects every other part of the body apart from those?
Yeah.
You're going to be telling us more about that, but how does it spread? What causes TB?
Okay, the infected person with TB, when they talk or cough or sneeze or even laughing or singing, those bacilli, they go into the air. And the person who is not infected inhale the air, it's usually contaminated with those bacilli. So they go through the respiratory tract and they go into the lungs. In the lungs, the body immune system can fight those bacilli, and they are able to contain them in the lungs, and they may develop, or when the immunity is low, they can multiply, and that's when the persons may develop the TB infection.
That means it spread through the air.
Yeah, you cannot transmit TB by shaking hands or by touching someone. You can't. It's only through inhalation of the contaminated air.
Thank you so much for that. And so, what are some of the risk factors, or who is more prone to get TB more than the other?
Okay, well, TB anyone can be infected with TB, but there are those risk factors which predisposes someone to be infected. One, it's in children. Their immunity is usually low. So when they are exposed to this TB, their immunity is not able to fight this infection. One is the children, the diabetic patients, HIV infected patients, those with other conditions affecting their immunity like cancer. So those are more prone to have the TB. And also we have these people with risky behavior, the alcoholic or those in other drug abuse. Even those, they are more predisposed to have TB. And also it also depends on the environment you are in. Those who are overcrowded or they are living in poor ventilated rooms or houses, those are also at risk of getting TB.
Now you told us it's going to be transmitted mostly through air. So someone who is living with TB or someone who has TB at the moment, should we keep a distance when we are talking with them? Like, which is a safe distance for us to be when we are around them?
Okay, it depends on which kind of TB this person is having. Those who can transmit TB are the ones who have pulmonary TB. And this TB, it was diagnosed, either the patient was given a container and they put the sputum, and when it is being processed in the lab, it shows those bacilli. So those are the ones who can transmit the TB. And when they come into our facility, we usually screen them for the question we usually ask them to screen. And when you suspect this patient have TB, you send them to the investigations. And when you do the smears, we call it smear, maybe it is smear positive, we inform them on the preventive measures they can do to prevent those who are close to them. We educate them about the cough etiquette, the issue of wearing masks. And when we put them on the medication, within 2 weeks, it's hard for them to transmit the TB. So we usually encourage them to put the mask on. And at home, they ensure the home they are living in, it's well ventilated. They open the windows, the lights, the curtains, so that the sunlight can be able to assess the room, because this bacilli usually multiply very fast when it is dark and when it's the humidity. Kuna humidity kwa room. That's when they multiply fast. So encourage them to be opening the windows, and when it's during the day, they spend most of the time outside instead of inside the room, because outside, see, kuna hear movement of the air. But after initiating them to treatment and they are taking their drugs well, within 2 weeks, it's very hard to transmit that TB.
Thank you so much. And you mentioned about one type of TB that that when someone is having that kind of TB, it's easy for them to transmit it to the other person. Yeah. That means there are types of TB. Yeah. Could you educate us on the same?
Okay, there are different types of TB. We have the pulmonary TB. That one usually affects the lungs. And there are two types of pulmonary TB. The bacteriologically confirmed TB. This is when the patient was asked for investigation for sputum and it turned out to be positive. Then we have clinically diagnosed TB. Yes, it's pulmonary TB, but when we do the sputum testing, it turned out to be negative. But when we do the other investigation like chest X-ray, you can see in the field, the lungs field, there are those cavities or opacities in the lung field. And also, through the history taking of this patient, he or she had those cardinal signs for TB. And that's when we say this patient has TB, but it's not bacteriologically confirmed, it's clinically diagnosed. Then we have the extrapulmonary TB. Extrapulmonary TB, it's other TB, not within the lung. This patient could be having TB meningitis, TB spine, TB adenitis, other form. As I told you earlier, TB can affect every other body part, a part of the hair, nail, and the tooth. So the other parts are the extrapulmonary TB.
Yeah. Now that means that if you have, for instance, meningitis TB, it's not going to be affecting the lungs, it's going to be affecting those other parts of the body.
It will affect the meninges. But usually the entry point of this TB was through the lungs. So when you inhale the bacilli, the body is usually trying to fight the infections. But some are being contained in the alveoli by the macrophages. But some may pass through bloodstream and they are taken to other body parts. And they are taken to the other body parts, they go there, and maybe someone's immunity is low, so they multiply and they develop to this TB into those body parts there where the blood has taken the bacilli. Yeah.
And do we have stages of TB where maybe someone is having TB and they don't know that they have it, maybe because it's inactive or...
Okay, for the TB, we have latent TB and active TB. For the latent TB, it's whereby you are exposed to those bacilli, but your body is able to contain those bacilli inside you. They releases the macrophages. These macrophages, they surround this bacilli, prevent this bacilli to multiply and to progress to be active disease. So that's when we say you have latent TB. Yes, you have the bacilli inside you, but it's dormant. It's not affecting you in any way. But in active TB, those bacilli have multiplied and they are affecting either your lungs or then you have the disease, the TB disease. So there is that latent TB and the active. Another difference is the patient with latent TB cannot transmit because that bacilli is dormant in his or her body. But in active TB, they can able to transmit the infections because when they cough, the bacilli will go to the air. An infected person inhale this and being infected. Also, another difference is the latent TB. It's the one which will progress to be active TB. But once when you have the active TB, it's if untreated, obvious, you'll die. It will lead to other things like death or other complications. But once you have the latent TB, unless it depends in someone. So once, yes, the body is able to contain that bacilli, and maybe when the immunity goes low or you are being exposed to another infected person, reactivate those bacilli zenye zilikuwa dormant zinakuwa reactivated, una progress to have TB. Yeah.
And now for someone with latent TB, should they be treated?
Okay, for now, the Ministry of Health has introduced a drug. It's called TB preventive therapy. It's usually targeting those patients, they are not patients because they are not sick, those clients who are exposed to TB infected persons. So what the drugs is doing, it's clearing the bacilli to prevent them to develop into active TB. So what we are doing for those who are exposed to seropositive. For the seropositive, it means this client was diagnosed with sputum, was told to bring the sputum, and it was analyzed in the lab, and the bacilli were seen in the lab. So for those households or in the working area, the person she's associating with, we usually encourage them to bring them. We screen them for the TB. If they are not infected, we give them the TB preventive therapy. For now, for the adults 15 years and above, their medication, they are just taking once a week for 3 months. But for below that age, they are taking for a daily drug for 3 months. Then for the for the HIV infected persons, they are taking, for the adult is the same for the HIV negative, but for the children, they are taking for once daily for 3 months. Yeah.
Thank you so much. And so what are some of the warning signs of TB? How could someone spot that these are maybe signs and symptoms of TB and then maybe visit a clinic?
Okay, well, there are those cardinal signs for TB. One is fever, and another one is night sweat. And the night sweat, it's drenching night sweat. Nile ukilala, ukiamka, unaamka ni kama mtu amemwagiliwa maji. And another one is uninhibited reduced body weight. Wewe sio wewe unaenda gym ili reduce your weight. Nile tu hata wewe huelewi kwenye kilo zako zinaenda. And another thing, it's cough. And nowadays we are saying it's cough of any duration. Yeah. Those are in adults, those are the signs. Although there are other signs we can add, like difficulty in breathing, chest pains, and shortness of the breath. But when we come in children's, the children's, they are patient, katoto tu kamekaa tu hivyo, hakataki kucheza na hayuko interested on the environment. Another thing, they are failure to thrive. Mtoto haongezi kilo ama kilo ziko tu stagnant, ama badala kaongeze kilo zina reduce. That's when those are the signs and symptoms for TB. And we usually encourage, ukiwa na any of those, kama ni cough ama any one of those signs and symptoms, you're supposed to go to the nearest facility to be screened and to be investigated for TB. Yeah.
Tusiseme ni homa.
Usiseme ni homa.
Sawa. And is it possible for one to have TB without coughing, that you have the other symptoms and you're not coughing?
Yeah, it's very possible, because I told you TB can be for the pulmonary TB, you'll have to have a cough because it's affecting our lungs. For the extrapulmonary, maybe you have TB adenitis. Obviously, will not have a cough. Maybe you'll come with a swelling on one side, swelling, but you have the fevers, you have the reduced body weight, and the night sweats, but you don't have the cough. Yeah, there's a possibility depending on which part of the body this TB is affecting. Yeah.
Thank you so much for the clarity. Now we hear a lot of relation between HIV positive patients and TB. Does it mean that their chances of getting TB are way higher? And how is it managed?
Okay, one of the opportunistic infection for HIV infected patients is TB. but there are interventions which are being put there to prevent this patient to be infected with TB. Usually for their routine clinic, they are being screened for TB. For TB, for their routine clinic, and when they have the signs and symptoms, they are being investigated further. And when during their routine clinic, if anyone's screened negative, they are being given TB preventive therapy to prevent them. Yes, their immunity is low, so they are at a higher chance of getting this TB. So they are usually given the TB preventive therapy to prevent them to getting this TB. Actually, for now, the prevalence of TB is high in HIV negative patients instead of HIV positive because of those interventions which are being put on place. Yes, we know this client, their immunity is being affected by his HIV, but by routine screening and provision of the TPT, the incidences or the prevalences of the TB, it's usually low, compared to general population.
So the general population actually needs to watch out more.
And
do we have other conditions that maybe that have been mentioned to heighten one's chances of getting TB other than HIV, like the way you're saying that with HIV positive patients, you are already aware that their immunity is down, and so you have to take such interventions. Do you have other class of patients?
Okay, for any other condition which is affecting your immunity, it's putting you at that risk. Conditions like cancer, we have conditions like diabetes. Those, yes, the immunity is compromised, and so the TB will take that advantage. Because we are saying that, like, when you are exposed to that bacilli or that bacterium, your body is usually able to fight, provided your immunity is strong. But when you have other conditions affecting your immunity, obviously your immunity will not be able to fight this bacilli, so it will progress into active TB. So those conditions, the diabetes, even during pregnancy, during pregnancy your immunity is low, so you are even more prone to have TB. The issue of the cancer, any kind of the cancer, it's affecting your immunity. And also maybe this patient is taking immunosuppressive like steroids, which usually lower your immunity. It's putting you into that risk of getting TB.
Thank you so much for that. And do we have some geographical areas, maybe due to things like weather, that are increasing the chances?
What I can say is that TB is more in urban area than in rural area. In urban area, there are those factors which will accelerate TB transmission. Like in urban area, watu wamejazana, sindio, there is overcrowding. The houses in the urban area, they are zimeshikana tu, they are not well ventilated. Even the sun, kuingia kwa nyumba inakwanga sometimes ni shida, juu umejengewa hii side na hii side. So there is that poor ventilation, poor source of the natural light to the houses we are living. So even in and also the way the people are living in the urban area, most of them kuna hizo crabs, watu wako overcrowded. The issue of the drug abuse, it's high in the urban area. It's kwa hizo crab na kwenye wanaenda kupata pia hizo drugs, obviously wako crowded because it's something they are kind of hiding. So it's more in urban area than in rural areas.
And you've mentioned drug and substance abuse, and mostly you've mentioned it in the aspect of that they're going to clubs that are overcrowded. But it alone, even if you're taking drugs or any other substance in a well-ventilated area, is it a risk factor? Is it going to heighten your chances?
It's a risk factor because it will affect your body, how it's functioning. It's really, so most of these drug addicts, one thing, their feeding is very poor. So kufeed ni ile tu labda nakula hizi fast food. So hakuli venye inafaa, na labda akikula the alcohol and the other drugs they are using they interfere with the absorption of those minerals, of those vitamins. So the immunity itakuwa chini. So when the immunity is below, they will not able to fight this infection when they are being exposed to the infections. Yeah.
Thank you so much. So can TB be cured?
Yeah.
Okay, it can be cured. And that is what you're going to be talking about after this quick break. Don't go away.
Kuza ICT Awards 2024 is here, and GTN TV has been nominated in the People's Choice Awards category as the TV Station of the Year. To vote, text Kuza to 15601 or visit www.kuzaawards.co.ke and vote for Grassroots Television Network. Voting is free. GTN TV, the home of gifts and talents. The Nyeri County Annual Tourism and Cultural Festival 2024, initially slated for 17th to 18th May 2024, has been postponed to 21st and 22nd June 2024 due to the heightened persistent rains accompanied by floods being witnessed in the region. We sincerely apologize for any inconvenience caused and assure you that all necessary arrangements are being made to facilitate a seamless transition to the new dates. For more information, contact the Director, Tourism and Culture, Mary Kimamo, on 0722233420 or email us on nyericountytrade@gmail.com. Thank you for your continued partnership.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo makaga hinya, gũikara ũkĩgandaga. Nĩkĩo Neema Health Clinic ĩgĩtongorio nĩ ndagĩtarĩ Mwangi ĩrĩ haha na ithuĩ. Oho nĩ marigitaga mĩrimũ ta kũhingana gĩthũri, ulcers na goita. Mũthenya wa mwambĩrĩrio monekaga Mahich Hotel, Murang'a Town, kũng'ethana na bengi ya KCB. Naguo wa kerĩ makoragwo Thika Rombogo Building hakuhĩ na thitĩnji. Wa gatatũ makoragwo Gĩthũngũri Diplomat House hakuhĩ na thitĩnji. Gũkũ nakuo mũthĩ wa kana makoragwo Maĩ Mahiũ harĩa Mathingira House hakuhĩ na thitĩnji ya Limuru. Wa gatano makoragwo Nairobi Nyamakima Moreline House. Na rĩu mũthĩ wa Jumamothi marĩkoragwo Nyĩrĩ Town harĩa Nyĩrĩ Star hakuhĩ na Naivas Supermarket. Nĩ ũndũ wa ũhoro makĩria hũra thimũ namba 0725-8641. Ũgima waku wa mwĩrĩ nĩ ũtonga waku.
Yes, welcome back. Thank you so much for keeping it GTN TV, the home of gifts and talents. This is the Medi-Camp Health Show, and today we are talking about tuberculosis. We've talked about how it is spread, how you're going to get diagnosed for it, and yes, what are some of the risk factors. And Doc told us before we went for a break that it can be treated. So now tell us, how is it treated? Because you told us it is curable. Yeah.
Okay, once diagnosed with TB, you are being put on TB therapy, TB management therapy, and you undergo a counseling. You are being informed for how long will you take these anti-TBs. For the TB, pulmonary TB, you usually take the medication for 6 months. Depending on your weight, you'll be told you'll be taking either 2 tablets, 3 tablets, or 4 tablets. For the TB meningitis, and TB spines, they usually take their medication for 1 year. And then their follow-up for that patient who was diagnosed with pulmonary TB and it was smear positive. The sputum, there were those germs, the bacilli. So we do follow-up with the sputum. We do it at month 2 to see how this patient is progressing. We do at month 2, then at month 5, and then at month 6 after completing our medications. And as you go for the appointment, we usually book them. The first 2 months, we book them weekly. And then after 2 months, we book them after every 2 weeks. And we monitor the symptoms, that is the cough, the fever, the night sweat, and the body weight as you come for your routine clinic. And we also, in case we are seeing like maybe at month 2, the smear was supposed to be converted to be smear negative, but it's still smear positive. We go further to investigate why is not your sputum not converting, and we usually set sputum to rule out if there is resistance for these anti-TBs we are giving you, and also we assess for their adherence, and also we ask if there is maybe someone who is near you who is having cough to rule out reinfections. Yes, maybe you are taking your medications well, but there is someone who is interacting with having this TB and not being treated. So that's how we follow our patient. For the extrapulmonary TB, we don't do the one who was diagnosed with smear negative, we don't do the follow-up smears. We do monitor clinically. Is this patient adding weight? Are these symptoms subsiding or are they still there? And then like TB, like let me give an example with TB adenitis. They usually present with a swelling. Is it swelling decreasing or is it the same? Yeah, that's how we monitor our patients. Yeah.
Thank you so much. So you're saying that treatment for TB can go up to 6 months?
Yeah, it's usually 6 months. But currently for the children, they have introduced another a period. Depending on the child, they have introduced. We give them for 4 months, but there is a criteria to follow that. Yeah, it was introduced this year.
Thank you so much. We love developments like that. That means that the society is better placed to get treatment. So now, are there chances that someone has treated it for the 6 months? Now they are well and it reoccurs?
We usually call it TB relapse. Yes, this patient was treated, and after treating the TB, there must be an outcome. Was this patient cured? Was it for the cured? Is the one we have been following with the smears. The smear month 5 must be negative and month 6. So the outcome for this patient is cured. So this patient, after like few months or after 1 year or any period of time, return again with the symptoms being investigated, and then the investigation turned out to be positive. Tunasema amepata akona TB relapse. So for this TB relapse patient, we have to rule out if this patient is having resistance because he was previously exposed to this anti-TBs. We'll give him or her. So they are being set for sputum for gene expert to rule out if there is resistance for rifampicin, and then we take another sample. We send it to Nairobi. It's being done for culture, drug sensitivity for the first line, to rule out the resistance for other molecules, that is the isoniazid, the erbitol, and the pyrazinamide. To rule out if they are having any resistance. Then we start the medication again.
And what happens in cases where TB patients, they are resisting the drugs or the biotics that you're giving them?
Okay, it's that one will be guided by how the result we had said, the result how they are. Maybe this patient have resistance for rifampicin. So that's a patient you can't manage as a ukuwa peke yake. Ni kitu mnakaa chini with the sub-county TB coordinator, with the county TB coordinator, and we involve even other physicians and other the nutrition. We sit down, we discuss about this patient. We even inform the national team for TB. And then we come with a way forward of managing this patient. It's usually a multidisciplinary team come up and discuss this case. And it's usually that patient, it's not the way we usually give them the medication and go, they take it at home. It's either they come on daily basis in the facility to take this medication, or the healthcare worker go to their home and give them each and every day. Until they complete their medications. Yeah, but it depends on the resistance this patient is having. Yeah.
Thank you so much. All we are hearing is that our government is really working hard, and we are all doing enough to curb TB or tuberculosis. But now, do we have some social factors that this is not really scientific to say or biological, but there are social aspects that are hindering actually curbing TB. Things like maybe stigma, that someone has it and they are hiding it.
Yeah, there are those factors, or false belief about TB. Uko kitambo mbeleni, a TB patient akiwa amejulikani na homestead, alikuwa anatafutiwa kasahani kake na kikombe yake, ili asi-interact na other wengine, na hao wengine hawa transmit TB. So there is what is happening. We are educating them, and also the CHP or CHV, they are doing a very good job. They are going kwa masinani, informing them about how they can relate with this infected TB. Although still we have that stigma and denial, which it's putting our relatives or those who are close to us at risk of getting this TB. So there are those, because you don't watch to mtu asikujudge, so unaona tu nyamaze na shida yako, and yet by kunyamaza hivyo you are exposing them to have this TB. And also there is this belief that kama uko na TB, well, HIV positive, which is wrong. Like I had said earlier, HIV, TB, it's more in other population, not in HIV, HIV patient, because of those interventions which are being put on them. So there is those amba labda huyu ni kulaaniwa, amelaaniwa kwa ndio maana ako hivi. Provided umekuja kwa facility, umetoa hiyo kikohozi imepimwa, then hotels unasema ni laana, hapana. That is thing umepimwa na ikakuwa confirmed. Just ongea tu na daktari wako, accept. Ili upone you have to accept. Ili to fight hii denial. Then when you take your medication well, utapona na uendelee na kazi yako, and it will reduce the burden of TB in our community. Yeah.
Thank you so much for that. So since we are not doctors, we should not be pointing fingers, and we should not be making such assumptions, because if you're diagnosed and then you're being offered interventions that could help you, then I don't see why we should be saying it's witchcraft or assuming this person has this other disease. And thank you so much for that. So can we prevent TB? Is it really preventable?
Yeah, TB is preventable. In preventable measures, I will put them in 3 categories. We have the administrative control. We have the protective gears. That is the second one. And another one, it's environmental control. For administrative control, it's usually we prevent the transmission of TB in our hospitals. It's whereby ukikuja kwa hospitali unaambiwa pitia pale kwa triage. So in that triage area ni penye huwa tunaweza kuseparate this patient. So huyu patient amekuja akona cough. So hutamwambia agoje na wengine kwa waiting bay because anaput risk kwa hao wengine wenye akona wao. So one in hiyo issue na triage, we educate them on cough etiquette. How are you supposed to cough? Si unakohoa tu hivyo, hizo vitu zinaenda tu kwa hewa. Na unajua we are sharing this air. Hakuna mtu amejibebea hewa yake.
Right.
So hiyo the cough etiquette, the issue of hand washing. Na tunaambia kama una cough, unatumia labda serviette or the handkerchief. Na hiyo handkerchief unaenda unaiosha na maji na sabuni. And also there is issue of the administration is we involve the CHV or the CHP to go there uko mashinani to educate the community about the TB. Those are the administrative. Then we have the environmental. Environmental control, it's whereby like the room we are living. It should be well ventilated. The source of lights iko sawa. Ili kuzuia labda huyu patient yes alikuja but na tukaongea kwa room, obviously we'll attend him or her in the room or in the wards. To ensure our wards are well ventilated. So ili hizo basta is in tuna ensure the windows are open. Such a thing, the dusting, the issue of dusting, the issue of disinfecting those equipment which are infected. So those are the environmental control, and also the protective gears. Like tukienda kwa hospitali obviously unaona daktari yako na ile kabuti ya white. Kuna mwingine time ya COVID tulikuwa tunavaa hizo mask. Those are the protective gears. They usually prevent you to get to be infected for TB. And hatuwezi sema patient tumepata TB from the patient. Pia patient kama daktari unaweza kuwa kuna hiyo TB. Ufanya nini? Usabazie patient. So we are supposed to take care on both sides. Daktari ajitekee care na pia the patient ajitekee care. So those are the preventive measures which can be put on to prevent this nini. And also in administrative, we usually encourage early diagnosis for this TB and putting this patient on treatment. Because once in the treatment, it's hard to transmit the infections. And if you are in a facility where you can't do this investigation, you just refer the patient for early diagnosis and also for the better outcome, treatment outcome for this patient. Yeah.
You talked about watu wasikohoe hivi. You teach them how to cough
etiquette.
Coughing etiquette. So how do we do it? Hata sisi wengine wenye we are not really in the hospitals, but
for the cough etiquette, it's usually you are being advised, maybe you have that handkerchief. You unajifunikia ukikohoa. Na ukikohoa kama kuna hiyo sputum imetoka, usiteme chini, iteme tu kwa hiyo handkerchief. And then after labda kwenda nyumbani, you wash it with warm water or warm water na sabuni, and then unaianika tu kwa jua. Another thing, si ati kukohoa ile unakohoa ati unajifunikia na mikono yako. That's bad. Kama ni kusneeze, hata kama kuna hiyo handkerchief, jifunikie tu hivi na nguo, jifunikie tu hivi. Ili ina reduce those bacilli, zisiende kwa hewa, na ili unaput mwenye ako close to you at risk of getting the TB or even other condition, even flu or ile time tulikuwa na COVID, even ile COVID. So we are preventing them to get those infections.
Yeah. Thank you for that important lesson. While you're talking about prevention, mostly we've talked about in the hospitals. Now, the communities, what is our role? What do we do to stop the spread of TB?
In the community, one of the things is if you have those signs, like I told you, maybe you have that cough, the fever, the night sweat, it's good you go to the nearest facility and being investigated. And maybe if you have the TB, will be put on the medications. And also the issue of cough. If you are practice that cough etiquette when you are coughing, avoid kutematema sputum everywhere. It's not healthy. And also if you are diagnosed with the TB, adhere to your medication. Tumia hizo dawa vizuri ili protect mwenye ako close to wewe. And also ukiambiwa uko na hii shida, that's not the end of it. We kubali, auliza daktari the way forward, you work with him or her kwa hiyo journey and you'll be cured. And also we try to avoid the hiyo overcrowd. Kama it's not a must, kunini acha kuenda, especially kwa immunocompromised patient. Kama you patient diabetic, uko pregnant, you avoid such areas. Na tukiwa kwa matatu, fungua dirisha. Hata kusema kuna baridi sana inasaidia juu hiyo hewa kwa matatu obvious. Dirisha zimefungwa, mko congested, open that window. It can save you. Na wenye wako wamediagnosewa the first 2 weeks or 1 month, kama unaenda kwa overcrowd, kama kwa hiyo matatu, put on a mask to prevent wenzako asifanye nini, asiwe infected. So I think and also there is this TB preventive therapy. If we reach on you, we told you are exposed to this TB, uko kwa mashinani, usianze kusema daktari mimi usinipe dawa mimi si mgonjwa. No, yes we know you are not sick, but you are giving you this medication kuzuia, because those bacilli ziko kwa mwili yako. Tunataka hii dawa iende iziue. Juu time yenye immunity yako itaenda chini, obvious ita progress uwe na hii TB. Accept kukunywa hizo dawa, badala ugoje tena time yenye unakuja TB imekufinyililia, hizo dawa unakunywa daily for 6 months. And yet this for preventive therapy, it's just once in a week for 3 months. Yeah.
Thank you so much. So other than that, TB preventive therapy, which mostly you're giving to people who are already exposed, do you have like a vaccine, something that could...
For the vaccines, it's the first, ile tunaitanga BCG. It's usually given to the babies to prevent them to get those extreme TB. So it's the vaccine we only have the BCG, but we currently for the adult we don't have. It's usually the medication, the TB preventive therapy medication. Yeah.
And we encourage those with young babies or the ones that should take the BCG that is available to go for it.
Yeah.
So as we wind up, Daktari, tell people, can it go away on its own? Maybe someone is ignoring medication thinking, nikahoma nitakaa kapite.
Okay, for, we are different. Na Mungu ametuumba ki different. Na venye Mungu ametuumba obvious, kuna hizo vitu ziko kwa mwili zetu huwa zina fight. When you are exposed to infections, zinajaribu ku fight those bacilli or those bacteria ili usipate hiyo ugonjwa. So maybe I can explain this using the natural history of TB. Kama tuko exposed, tuseme tumejaa kwa hii room. Around 70 to 90 hawatakuwa infected. Around 10 to 30 wanaweza kuwa infected for this. No, around 90 hawatakuwa infected. 10% wenye wamekuwa exposed wanaweza kuwa infected. Hawa 10% wakiwa infected, 10 to 30% of them wanaweza kuwa na hiyo latent TB. Inakuwa latent. Lakini the other population, the other percentage, wenye wamekuwa exposed wanaweza ina develop inakuwa nini? Active TB. So kwa hao wenye ita develop to active TB, kuna percentage of them, 50% obvious saa hii kuna gap ya kudiagnose TB in our community. Unapata labda in a month you are supposed to, like in our facility, tunafaa kuwa na 11 patient wenye tumeinitiate anti-TBs. But unaweza pata this month tumepata 8, so kuna hiyo gap. So kaha 50% wenye umediagnosewa, 50% wanakubali wanakuwa diagnosed, wanakuja wanapewa nini? Dawa. Kuna ile ingine 50% yenye ilikuwa missed. So kwa hiyo 50%, percentage like 25% wanaenda kwa hospitali, wanatibiwa, wanakuwa cured. 25% wanakufa kama hawajui nini iliwaua. Na yes, labda ni TB ilifanya nini, lakini ni vile hawakuwa kwenda kwa hospitali, hawakuwa diagnosed. So kuna a percentage yenye that infection it's wataendelea tu kuwa sick. So na hawa kuwa sick ndio wanaenda kufanya nini? Kutransmit this TB kwa nini? Kwa community. So once you have the TB, you are supposed to come to the facility, kuzuia the death, the other complications for this TB infections, ku prevent pia the transmissions, ili at least tuweze by there are those strategy they are being put by 2030 they want to reduce the TB incidence by 90%, and TB death by 95%. Then by 2050 they want TB to go and kusikia tu tunaisikianga huko Kenya. And we can't achieve that kama bado tunaendelea kuwa undiagnosed patients who are having TB uko kwa society. Do hawakuji kwa facility to be seen by the doctor, to be set for the investigation, ili wawekwa kwa hizo medication. So it's upon us uko kwa community, if you have any of that sign, hata kama ni moja, just go to the nearest facility ili tuweze minimize the prevalence of TB in our society. Na ina affect mpaka watoto wetu wenye wako innocent. Because kama mimi kama mama ya mtoto niko nayo, tuna interact na huyo mtoto, naenda na infect huyo mtoto. So it's good kama uko na any those signs, you come to the facility, you've been screened, you've been investigated. Ukipatikana uko nayo, kunywa tu dawa and you'll be cured. Because TB it's curable once you take your medications. Yep.
Thank you so much for that. So let each and every one of us step up and do their role. And if you're a community member with any of the warning signs, kindly visit a clinic so that you don't spread to the others. If you've already been diagnosed, kindly take your treatment and everything is going to be well. You're going to attain our 2050 vision. Yes, that TB is going to be a story of another day. So thank you so much for tuning in. That's why we're going to be wrapping it up. And always just remember that your health is your wealth. And so guard it whichever way you can. So see you in another episode. My name is Mumbi Mavuti.
Thikũ ici andũ aingĩ nĩ mathĩnio nĩ mĩrimũ ya nerves ta gũturwo nĩ marũngo, ciande, ciara, marũngo